Hello, my name is Sven Becker. I'm an ENT specialist and allergologist at the University Hospital in Tübingen, Germany. I want to present you the latest data on AM-301, a barrier-forming nasal spray which we tested in patients with seasonal allergic rhinitis, versus saline spray in a randomized clinical trial. Main columns of treatment in allergic rhinitis are allergen avoidance, symptomatic therapy, and allergen immunotherapy, whereby allergen avoidance, especially in patients with pollen allergy, is hard to achieve. However, we can still try to protect the nasal mucosa from getting into contact with the allergen by applying some sort of barrier. This is the concept of the nasal spray AM-301, also known as Bentrio. After spraying, it forms a thin gel film on the nasal mucosa for a few hours. This spray is thus establishing a physical barrier and does not need any active substances, so it is drug-free and also free of any preservatives. After 2 positive clinical trials in an exposure chamber, AM-301 was now tested during the grass pollen season. Therefore, 100 patients with proven seasonal allergic rhinitis to grass pollen were randomized into 2 groups, one using saline spray, one using AM-301 3 times daily for 2 weeks during the season. Primary endpoint, as you can see, was the reflective total nasal symptom score. Both treatment resulted in a reduction of nasal symptoms from day 1 on, as measured by the RT-NSS. The AM-301 group showed a stronger improvement of symptoms over the complete study period in comparison with the saline spray group. Averaged over the 2 weeks treatment period, the RT-NSS was 5 points for the AM-301 group compared with 6.1 points for the saline group. This difference was statistically significant for the primary endpoint. The improvement in nasal symptoms was corroborated by a significant improvement in health-related quality of life as measured by the Rhinoconjunctivitis Quality of Life Questionnaire, or RQLQ. Patients treated with AM-301 had significantly lower levels in the RQLQ and all-included subscales than those patients treated with saline spray alone. Importantly, the superior efficacy provided by AM-301 did not come at the expense of tolerability or safety. Study participants actually rated the tolerability of AM-301 and the saline spray quite similar, with good or very good. Taking together the results from the current as well as the previous studies, AM-301 is able to significantly improve nasal symptoms as well as related quality of life in patients suffering from seasonal grass pollen allergy using a drug-free barrier approach. The treatment was significantly more effective than saline nasal spray, the current drug-free standard of care, while offering a similar tolerability profile. AM-301 appears to be a safe and effective option against airborne allergens. If you want to have more information about this topic, please see our publication via the QR code, and thank you for your attention.